Hafa day, everyone. Thank you for being here this afternoon. Today, we are acknowledging and recognizing Prescription Opioid and Heroin Epidemic Awareness Week on September 18 to September 24, 2021. I'd like to thank Senator Mary Camacho Torres for being with us today, Mr. Fred Nishihara, and also Director Teresa Ariola from Behavioral Health and Wellness. So thank you everyone for being here so that we can acknowledge this moment in time where we can, as a community, come together and seek solutions for the challenges that we face when dealing with the opioid and heroin epidemic. So I'll just read the resolution. Relative to recognizing and observing Prescription Opioid and Heroin Epidemic Awareness Week on September 18 to September 24, 2021, and to further commending community stakeholders, organizations, and nonprofits in their collaborative effort to prevent substance abuse. Be it resolved by Imanay Trentay Sais, Nalasatuan Guahan, whereas the misuse of addiction to opioids such as heroin, morphine, and other prescription pain medicines are a serious national problem that affects public health as well as social and economic welfare. The various known opioids are categorized as controlled substances by the United States federal government due to the addicting nature of the drugs. And whereas the legalization of opioid use in the United States began in 1775, opioid drugs were used to treat injured soldiers during the Civil War in the 1860s, and many became inflicted with addiction. And whereas prior to the enactment of the Harrison Narcotics of 1914, opioids were largely unregulated and easily accessible. The act was established to place restrictions on opioids in order to limit their commercial use. And whereas in 1970, the Comprehensive Drug Abuse Prevention and Control Act was enacted into law and created the 5 classes of controlled substances that labeled the likelihood of addiction from the use of controlled substance. The Controlled Substances Act, Title II of the Comprehensive Drug Abuse Prevention and Control Act of 1970 is the legal foundation of the United States government's fight against the abuse of drugs and other substances. And whereas in the 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates, which subsequently led to the misuse of these medications, before it became clear that these medications could indeed be highly addictive. And whereas roughly about 21% to 29% of patients prescribed opioids for chronic pain misuse, between 8% to 12% people using an opioid for chronic pain develop an opioid use disorder, and an estimated 4% to 6% whose misuse of prescription opioids transitioned to heroin. Whereas opioid overdose began to increase in 2019, nearly 50,000 people died from opioid-involved overdose, and more than 14,000 people died from a drug overdose involving heroin in the United States. Nearly a third of all opioid deaths involved heroin. And whereas the opioid issue has become a public health epidemic, with devastating consequences, not just with overdoses, but also with the rising incidence of newborns who experience neonatal abstinence syndrome, which increased by almost 300% between 2000 to 2009, because their mothers were prescribed an opioid drug during pregnancy. And therefore be it resolved that the Committee of Rules of Imanay Trentay Sais Nalasatuan Guahan does hereby, on behalf of the people of Guam, recognize and observe Prescription Opioid and Heroin Epidemic Awareness Week on September 18 to September 24, 2021, and to further commending community stakeholders, organizations, and nonprofits in their collaborative effort to prevent substance abuse. And be it further resolved that the Speaker and the Chairperson of the Committee on Rules certify and the Legislative Secretary attest to the adoption hereof, and that copies of the same be transmitted, thereafter transmitted. Guam Behavioral Health Wellness Center, Department of Public Health and Social Services, the Attorney General of Guam, and to the Honorable Lourdes A. Leon Guerrero E. Magahagan Guahan. duly and regularly adopted by Imanay 26 Nalas Latoran Guahan on this day of 21st September 2021. So I'd like to thank all of our stakeholders who have started nonprofits, who work in our government agencies that assist in helping those who are addicted to opioids and heroin and other highly addictive drug use. We know that behavioral health has many programs that the community can now avail to, and they have expanded. And before we touch on that, I'd like to invite Senator Mary Camacho Torres to say a few words, because she has also been a very strong advocate in this area of need within our community. So Senator Torres, do you have any questions or comments?
Thank you, Senator Nelson. I first of all want to thank you for this recognition of this Awareness Week, that everything that impacts any solutions has to first begin with awareness and an acceptance that there is a problem that we have to address collaboratively, not only as providers, but also as policymakers. And I thank you for acknowledging the work that we've done so far, and mostly in the discussion purposes, looking at how we can actually implement policies that will have an impact on our community and help curb the drug addiction issue on Guam. But I just want to comment that with this awareness also brings the opportunity for us to continue the dialogue and to come through and with some sound policy in the upcoming months that we can actually put into bill format. And Director Ariola, you've been a wonderful person to work with. And I thank you for extending all the time whenever we call on you, Senator Nelson and I, extending not only your expertise and point of view, but that of your colleagues at Behavioral Health. So I pledge to you that we'll continue the effort. But thank you first and foremost for making us all aware that we have a problem that we have to work with. And of course, Senator Amanda Shelton is always a good colleague as well to work on this effort. Sus Maasi.
Thank you, Senator Torres. And I'd like to thank Senator Amanda Shelton for joining us, and Senator Moylan. Forgive me if I didn't catch you earlier. We have the Zoom screen is limited to the participants that are there. So thank you very much for joining us. Senator Shelton, is there any, you're free to say a couple comments, or if you have any questions that you'd like to ask.
Oh, thank you very much, Senator Nelson, Senator Torres, Hafaday, to our partners at Behavioral Health and at the Attorney General's office, Seduas Masi, for your work to bring awareness to this issue in our community, and all of our other partners who are working every day to stop addiction, to put an end to addiction, and to help those in our community recover, because we know how devastating addiction can be, breaking down our families and really causing so much strife. And it's a lot of suffering to the people of Guam. So I appreciate the work that you do. And Senator Nelson, thank you for bringing awareness to this and reminding us to keep it in the forefront of our minds that we want a healthy, a strong, a safe community for everyone. And awareness of this issue will continue to push us to fight for that. Seduas Masi.
Thank you, Senator Shelton. Senator Moylan, would you like to make some remarks?
Thank you, Senator Nelson. And for the resolution, and likewise, as Senator Torres was explaining, looking forward to some good measures coming out on this in support of the resolution to further strengthen the rehabilitation and the health of our island. So thank you very much.
Thank you, Senator Moylan. So, Director Ariola, I would like to call on you. Perhaps you can speak about the great strides that you as a director that you have facilitated thus far in expanding the programs within behavioral health and wellness. Would you like to expand on that?
Thank you, Senator and Senators Torres, Shelton, and Moylan. Nice seeing you, Fred. It's always a pleasure. Thank you very much. It's I guess it's not coincidence. Nothing. I don't believe in coincidences, but as you bring awareness to this week, Guam Behavioral Health has started this morning and all day tomorrow a 2-day substance use disorder conference with over 1,000 participants registered. So that's kind of where I mentioned earlier, where most of the clinicians and all the NGOs that are in recovery and addiction work is probably at. And I know that's where most of my drug and alcohol new beginning staff is at. And so it's very appropriate. And so we have our second annual virtual conference. We had the pleasure of SAMHSA's Region 9 administrator speak, Governor Leon Guerrero, of course, spoke, and our technical center advisors speak this morning. And there's so many conferences and sessions in the conference with presenters from all around the world. One of the things I want to thank Senator Nelson and all of you, really. I mean, everyone in the room, I can honestly say, are very supportive of Guam Behavioral Health. So thank you very much. I want to highlight that with the Office of the Attorney General, and Fred knows this very well, we have partnered. They reached out to us. They won the class action suit for the opioid class action suit. And so Guam Behavioral Health, they're partnering with us. We're getting a piece of that so that we can hire clinicians in the substance use disorder for the Department of Corrections that, as you all know, Guam Behavioral Health is now is in charge of in managing the mental health and substance disorder programming at the Department of Corrections. So thank you. A big shout out to the Attorney General's office for reaching out and partnering with us. A lot of good things have happened even during this time of uncertainty. We are probably in the worst surge of the pandemic, but I want to say that we have always had a drug addiction pandemic for 3 decades now. So before COVID hit the shores, we had a pandemic, and it's called drug addiction, drug and alcohol addiction. And so Guam Behavioral Health has not only launched during this pandemic time, 2020, our first virtual conference. Today and tomorrow's our second. We opened a detox unit a couple months ago, and somebody very close to Senator Torres is one of the people in charge, Dr. Torres Haddock. And so we're just so pleased because that's another added service to the people of Guam. And it's a medically treated detox unit. And so when they meet the criteria, we admit, and they'll be properly cared for by doctors and mental health professionals. So that opened during a pandemic. And I'm very pleased to say that this morning the governor announced I've been advocating for funding for the renovation of more recovery beds. As you recall, more recovery beds. There's not enough. We have NGO partners such as Lighthouse Recovery, Oasis, Sanctuary. We do not have enough recovery beds for all the people of Guam that need it. And so with the help of the administration and identification of the Department of Interior funding, and thank you to Governor Leon Guerrero and Lieutenant Governor Josh Tenorio, they have put aside Department of Interior CIP money to renovate what was a building, a beautiful residential building that has been sitting dormant and unused in Talafofo, the beautiful hills of Talafofo. Very tranquil, very appropriate for treatment. And that's the known cottage homes that used to be with Department of Youth Affairs. It has now been transferred. We have identified the money for Department of Interior CIP funding. It's going to get renovated. I just got the notice this morning from the front office. So those are good news. That's Renovation should happen between now and December, and more recovery beds will be available in the new year. In addition to that, funding for a little bit from SI 2001 Department of Interior CIP money, as well as most of the bulk coming from FY22 has been set aside by this administration to build a new beginnings facility at the department. Why is that a big deal? Because if we recognize that New Beginnings is the home, if you will, of recovery and a conduit for our people to get referred to our nonprofit organizations that the government, the legislature has supported through our budget. We need a decent home for New Beginning. They have been renting for the last 15 years. It's unacceptable to me. And so I did my pitch. My governor heard me. They found the money, and now we're going to break ground. And so that is true commitment and putting, your feet to the, instead of words, it's action. And so I couldn't do it without the legislature. The budget includes funding for NGOs. We cannot do this without our partner NGOs. Again, Lighthouse Recovery, Oasis Empowerment, and Sanctuary for the youth in addiction. But also I want to recognize TOGI. TOGI is a nonprofit organization for peer support. I just ended a national mental health and substance use conference for my counterparts from across the nation last week. And all that people are talking about is how important peers are to recovery, because our sick individuals and family members in addiction can relate better to somebody who's walked in their shoes versus somebody who hasn't and is telling them this is how you recover. So peer support is really, really important, and it goes hand in hand with all the Guam behavioral health clinicians and everyone, all the stakeholders and supporters. So I want to give a big shout out to Brian Hahn and the TOGI organization. And so that's, for now, a little bit of what we're doing. This morning's plenary session at the conference talked about healing care versus trauma-informed care. And just a little bit of headway. You're going to hear I'm going to be talking a lot about that in the near future, about how we need to approach recovery, not as in trauma-informed, but a healing, to include the healing of our practitioners who support those in recovery. So it's a different paradigm shift in the national stage, but it's all good. It's all good. And it's all about well-being and healing. And so I want to thank you all for all your support for Guam Behavioral Health.
Yes, and thank you to you, Director Ariola, because under your leadership, we've seen the growth of the capabilities of Guam Behavioral Health, which is really a huge undertaking, and the impact it has in the community. And thank you for working very hard to, secure those additional areas, because you're right, it's the recovery beds that are needed. If an addict says that they need help, they need that help right away. You can't turn them away and say, come back next week. Because it's a very serious situation it's that they're going through. And so the realization when they need help, we need to be able to welcome them in and not have them wait on the support that they so desperately need. Okay, and we have Fred Nishihara from the Attorney General's. Fred, would you like to say some words on the outstanding work that you have done, your team has done at the Attorney General's office?
Yes, I will say team, but to Director Ariola's point, good job in the work they are doing. They are also keeping us very busy too. We work hand in hand. I know we have also worked with both you, Senator Nelson, as well as you, Senator Shelton, in some of these areas. But, you know, I gotta say, I appreciate this particular resolution because you don't know the magnitude of the problem until you actually learn of the problem, right? So this is what this does. And what happened was when AG Camacho came on board, we decided to join some other jurisdictions that were bringing suits against these opioid manufacturers, as well as the chain of supply. We've actually had some fruits. That's what you heard Director Ariola talk about. We've had some settlements, and this is just the beginning of settlements or lawsuits. So we do incur some cost that we use out of the consumer fund, and some of that recovery money is used for further investigation because we have to pay our share as along with the other attorney generals involved. The particular one that Director Ariola had talked about was, I'll call it landmark, except for maybe the tobacco settlement case, you know, which goes on for perpetuity. This was the beginning. It was a $231,000 settlement for supply chain. McKinsey was the name of that one. So AG Camacho was able to secure it. I think the money came in July. So we actually received the check. The terms of each and every one of these settlements vary slightly in what they're used and how they're used for. Most of them focus on abatement, some do for education, and some others also do for, I'll say, treatment. So instead of money, they give product, right? You know, it's for treatment. But I was surprised at the magnitude of Guam. When we brought the lawsuit, for example, between 2015 and 2019, we had 97,000 opioid prescriptions dispensed on Guam. And for the year of, let's see, the year we brought lawsuit in 2019, 2018 to 2019 summer, we had 200 doses of naloxone that was administered. So that's the treatment for overdose of an opioid. So some of the funds that we have used for this was because we need to establish kind of a baseline, right, for all of our lawsuits, like how bad is the opioid epidemic here on Guam. And although we can do some tests, we can't determine the amount of opioid that is in a person who passed away. And so we just bid out, I want to say last week, the toxology reports, which will help establish how much opioid, or for that matter, what type of drug is in there, because a lot of these drug overdose cases involve more than one type of drug. So we just issued that IFB. We expect to get results probably in 2-3 weeks, well, maybe a month at the latest, but soon. The other highlight maybe that I would like to say is we're still involved with some pretty big, large opioid cases, including like Purdue, Mallinckrodt, you know, some of the big manufacturers. And so we continue to work gathering information as required, discovery with Director Ariola and so forth. When I say so forth, that was public health too, because they keep a lot of records. So it's a lot of day-to-day work. But you know, it's kind of gratifying to see at the end of the day, we have nonprofit organizations, the ones that Director Ariola just mentioned, that we are also working with. And besides the money and the support to help run their programs, we are able to help. And when I say we, other government agencies, like for example, we had found out that one of the most difficult things to recovery is just getting a simple ID. And it sounds easy, right? But it's such a difficult task. And the reason you need ID is to get power bill, to get a house, to eventually get a job, right? So we've been able to work with other government organizations and form MOUs to help these recovering people get some ID so they can basically go on with life. But all of this starts with knowing that there is a problem. So senators, I really appreciate it. I definitely want to give a shout out to Director Ariola, the other government agencies, and especially our nonprofits, because a lot of the nonprofits have volunteers that just work for out of the goodness of their heart. So thank you for the resolution. We definitely support it. We definitely support additional legislation that will help in this continued fight against opioids. Thank you, Senator.
Thank you, Fred. And you know, thank you for sharing with us the the need to understand these, to gather the data, especially when it comes to the toxicology reports. Just several years ago, a young friend of mine in his 20s, overdosed, and it was very hard. It was very hard to see how we can tackle this issue, because you're absolutely right. You really don't see it. You don't see it unless you're either living in it, or in some way you have a friend or a family member that has fallen to this type of addiction. And so, thank you for all the hard work that you do at the AG's office, especially to continually advocate for the need of the community in these type of areas. So thank you as well. I believe Senator Ada and Senator Joanne Brown joined us. We are on the opioid and heroin epidemic awareness resolution. Would you like to speak on that, Senator Ada?
I'd just like to thank you, Madam Chair. Just like to thank Director Ariola and Fred for all the hard work that they do in the collaboration. A lot of times our people don't realize the addiction that can happen with opioids, and sometimes they don't recognize that they are addicted. And we just want to continue to support you in all ways that we can, and continue to do all the hard work out there, and to your partners, both public, private, and NGOs, and volunteers most especially. Without them, I don't think our government will be able to do the things that we do and continue to help the people who needs the help. So thank you for all that you guys do. And Madam Chair, thank you for this resolution as well.
Thank you, Senator. Senator Brown, do you have any comments or remarks you'd like to state at this time?
Thank you, Madam Chair. Just very briefly, I think all the awareness that can be brought out there is a very good thing. Unfortunately, we have a growing challenge, some in our community and in the country, of our people that, are getting on different types of drugs for different reasons. I think we're the most prescribed generation. And unfortunately, some people might take it for, they need it for medical related reasons and then become addicted to it. And unfortunately, that creates a whole other set of problems. But every effort we can make to get awareness out there for people that are and desire recovery and can move away from this, because it's not a good thing overall to their health or their quality of life, I think is a very good thing. And I think reminding our community about these issues, there are those that suffer and they're the families that suffer with them as well. So thank you for providing this resolution publicly and presenting it and getting that awareness out there. Thank you so much, Madam Chair, for the opportunity to comment.
Thank you, Senator Brown. Okay, that will conclude our resolution, and we will be sending it over to you guys. I'm going to do what the speaker does and show you it. And so we put it in frames. So thank you so much for your hard work. And also, everyone that works within our government agencies and our nonprofit organizations, thank you for the sacrifices you make. And especially to Togi for their resiliency and their perseverance to navigating through their addiction and helping others with who are recovering addicts. So great job out there. And we will take a quick recess and we will move into our next resolution presentation. We'll be back in 5 minutes. Thank you, Fred. Thank you, Director Ariola, for being here. Bye-bye.